Hi, I'm Brian Shaw, Certified Diabetes Educator here at Sacramento Native American Health Center. Welcome to our latest series of videos where we talk about expectations for care, both what providers hope for patients as well as what patients hope for providers every time they seek care, whether you come here to Sacramento Native American Health Center or whether you go somewhere else, whether you have chronic conditions like diabetes or whether you're just getting general routine care at anywhere you go. We want to make sure that your visit goes efficiently, goes well, and that your priorities are addressed. So today we're going to visit with our newest member of our medical team, Julie Olmashakin. All right, Julie, what are the 3 top things you hope that patients know before they come to get care from you here?
That's a great question. I think one thing I would like my patients to bring or to know is the medication list. That could be either bringing your bottles with you to the doctor's appointment or going to your pharmacy and asking for your medication printouts. Also, it would be great to know your symptoms and your illnesses. Write them down. Is your cough getting worse? Is your cough getting better? Is your cough dry and now it's wet? So it's a good idea to write your symptoms down to know the progression of the illnesses. And last but not least is just to know any medical record you might have with you, your doctor's previous name and phone number, anything that relates to your illness that can help me improve your health in the clinic.
Great, so you said 3 things that were the most important to you. The first one was a list of medications. It's always important for patients to come with a list of medications that they take, the dosages and the time of day that they take them. You can get that from the pharmacy or you can write them down yourself. The second thing you said was a list of symptoms and how they might have changed over time. I might suggest that you write your symptoms down, how they've changed over time, as well as the top things that are the most important for you to address with your primary care provider each time you see them, so that we can focus the attention on the symptoms that you're having. And the third one that you said, Julie, was come with a list of medical records from your prior doctor. How does a list of medical records from their prior doctor help you?
So it helps a lot because it tells me where you're coming from. So for example, if you had the A1C of 5.8 in 2016 and now is 10.3, that tell me your diabetes is getting worse. It give me a progression either in the positive or negative of your illnesses. Or let's say your A1C was 12 in 2016 and now it's 5.8. That tells me you've been doing a great job, and so I know how to help you to either sustain your better A1C or help you if it's getting worse. So yes.
This is excellent information, Julie. So in summary, it would be most helpful when patients come to their visit that they have a list of the medications, the dosages and times of day that they take the medicines, a list of the symptoms and other health problems that they have, prioritizing the most important thing you want to get done during the visit, a list of medical records from the prior doctor, and it also might be helpful if you have a chronic condition like high blood pressure or diabetes, that you bring a log of your readings so the provider can help you best dose with the medication that matches your readings. Julie, I'd like to know if you have any last words of wisdom for us about patients when they get care from you.
Thank you, Brian. So one thing I want my patients to know is this. So my job as your provider is to partner with you in sharing decisions together. That means your medications, your illnesses, your symptoms, your medical records is a good tool to help me partner with you in improving your health. Thank you.
Great, thank you for joining us today, Julie. I really appreciate getting your input on how we can help patients live a better life.
Thank you for having me.
Please join us for our next video where we ask some patients what their expectations are for their providers when they come and get care. And as always, we want you to get the best care possible, whether it's here or somewhere else. So join us again for our next video where we'll talk more about these important topics. Bye.